Hi everybody, I thought we'd give you a quick update on what we're going to cover in our new dermatology course starting in January. It's divided into 3 different modules. The first of those modules, we're going to look at the investigation of the pruritic dog, and the sort of things we're going to cover is how to take a good clinical history, which is obviously really key to starting off every single case that we do. We're going to look at the distribution of clinical lesions on pruritic animals and how that can help guide us to look at differential diagnoses. We're also going to look at key diagnostic tests, simple, straightforward, basic tests, how to choose the appropriate site and how to do those tests well. The second of those modules, which again is broken up into small bite-sized little lumps for you so you can do them at your leisure, is going to deal with things like ruling out ectoparasites. So how to take the samples, the best places to get them from to get the best results, and then things like empirical therapy. We're going to look at investigating cutaneous adverse food reactions, how to food trial animals, little tricks of the trade that can make it a little bit easier for you. And we're going to look at how to investigate and to manage infection, which is a common complicating factor in allergic disease. And then the third of those modules, which of course is the most important clinically, is how to actually manage those cases. We're going to look at what we would call foundation therapy, so the use of things like cyclosporin, glucocorticoids, things like oclacitinib or lokivetmap, and of course allergen-specific immunotherapy, which is something that's been around for a long time and is something we don't perhaps use as much as we should do. So a little bit of a neglected form of treatment. We're also going to look at supplementary therapy, things like essential fatty acids, things like antihistamines, whether they play a part. And we're also going to talk a little bit about skin biome and how important that is in controlling disease. We'll also talk about managing acute and chronic flares. So I hope by the time we've finished, you'll feel confident in being able to manage these pruritic dogs much more effectively than you have done before. I look forward to seeing you all in January.